signs, sometimes called vital functions, are described as temperature, pulse, respiration, blood pressure, and more recently, pain. As you recall from other lessons, it's very important that these are measured accurately, as they tell us a great deal about the patient's condition. Hi, I'm Kathy Getrust. I'm an instructor in community health, and today we're going to be talking about some of those alterations in vital functions that can occur. The first is alteration in temperature. When heat production exceeds heat loss, the body temperature rises above the normal range. When this happens, the person is considered to be febrile or having a fever. Fever can result from serious injuries such as burns. You're more knowledgeable about fever with infections. Also, it can happen with surgery, or if there's damage to the temperature regulating center in the brain. Signs and symptoms of fever may include hot, flushed skin, faintness, headache, nausea, and even with excessively high fevers, there can be seizures. It's important to report any elevated temperature and observation to the nurse immediately. Check the room temperature and adjust it if needed. Sometimes elderly particularly will have the settings of their residence way higher than might be acceptable for their body's best health. Reduce any excess clothing and coverings. Encourage fluids if it's tolerated and allowed. And then check their vital signs as ordered. Sometimes it may be required that you check it every 1 hour, every 2 hours, or even every 4 hours. Hypothermia is another alteration in temperature, and it's really the opposite of fever. This is where there is a drop in the core body temperature. People that are exposed to cold without adequate protection can develop hypothermia. Consuming alcohol alters the body's response to cold. Therefore, anybody that is intoxicated and gets into a cold situation can become hypothermic much more easily. Signs and symptoms of hypothermia may include shivering. This only happens, though, in the early stages of hypothermia. There may be poor coordination, meaning that they have difficulty walking. They have speech difficulties. There might be confusion, and there would be certainly a decrease in the vital signs of temperature, pulse, and respiration. You as a caregiver in this situation have a responsibility to report any and all of the observations of hypothermia to the nurse. Remove the patient from the cold environment immediately and remove any wet clothing and provide warmth with a sweater or extra blanket. And then be available to check vital signs if they are being ordered more frequently than usual. Another type of alteration besides temperature is an alteration in circulation. The first is fainting. Fainting is a loss of consciousness due to a temporary lack of oxygen to the brain. This sometimes is also called syncope. It can be due to an insufficient output of blood from the heart. It might be due to also a low fluid volume if a person becomes, for example, very dehydrated. They may be more susceptible to fainting. It is a very good measure of the heart status. It may occur when a patient tries to stand up after being bedridden for a period of time. Maybe you've had that experience when you jump out of bed quickly and your body does not adjust soon enough to the change in position, and you might feel lightheaded. This is a common occurrence, particularly with people who have been on bed rest for extended periods of time. Fainting comes on gradually. You can feel lightheaded, you can become pale, perspiration occurs, nausea might happen, could have blurred vision, muscle weakness, and if it's continued, can go on to a loss of consciousness. Syncope or fainting usually can be managed by anticipating it. Expect patients who have been on bed rest for a period of time or are immobile to have dizziness when they change position from lying to a sitting position. That means you would have the patient move slowly and start to rest and stop to rest in a sitting position before having them stand. If the patient feels faint, instruct them to breathe slowly or deeply and to keep their eyes open. Syncope usually will resolve in a few moments. If not, help the patient to sit or lie down, loosen any tight clothing, and make certain that he or she is breathing. If they do not regain consciousness in several minutes, signal for help. Stay with the patient, but do not offer them anything to eat or drink, and of course provide reassurance. Shock is another alteration in circulation. This is a disturbance of the oxygen supply to the tissues and return of blood to the heart. It can follow any serious injury, cardiac disease, acute hemorrhage with lots of blood loss, or shock can also happen with severe pain. Early signs and symptoms of shock include pale, cool skin that's moist to the touch, complaints of weakness, a weak, rapid pulse, sometimes it's called a thready pulse, restlessness, anxiety, and sometimes a feeling of impending doom. Perspiration can also be a sign. Later signs include mottled skin. Mottling means a reddish purple blotchiness to the skin that indicates an altered circulation. There may be a loss of consciousness and a decrease in blood pressure and temperature. Anxiety aggravates the situation, but shock sometimes can be prevented if steps are taken early on. Call for help. That means activating your emergency medical